Hello, and welcome to Why It's Hard to Get Care and Get Well, Breaking Barriers to Good Mental Health. My name is Valerie Cordero, and I am Co-Executive Director of Families for Depression Awareness. We are so happy to have everybody viewing this webinar today. We hope you will find it helpful. We do have a question and answer feature in this Zoom webinar. If you have a question, feel free to submit it through that question and answer panel, and we are going to get to as many questions as possible at the end of the presentation. We also do have the questions that were submitted ahead of time, so we will try to get through as many of those as possible. The chat should be enabled. I'm going to make sure we have that enabled. And so if you'd like to use the chat, feel free to do so as well. For the webinar today, I'm going to talk a little bit about Families for Depression Awareness so that everybody has an idea of what we do and what our mission is. And then we're going to get into the meat of the presentation with Dr. Jackman and Dr. Geyer. It's going to be a wonderful, wonderful discussion on barriers to care and how to overcome those barriers to care. We're going to do a little bit of caregiver self-care. We're going to talk about the social determinants of health, what that term means and how it really applies to your everyday life or the everyday life of your loved ones. We're going to go through a couple of scenarios that will help you understand and put into practice some of the things that are discussed by our expert presenters. And then, like I said, we will get to the question and answer period of the webinar. So be sure to add those questions in. And again, we'll get to as many as possible. We will also ask you to fill out a survey at the conclusion of this presentation. If you do that, you'll be entered to win a prize. So we hope that everybody who watches does complete that survey. Families for Depression Awareness is a national nonprofit organization. Our mission is to help families recognize and cope with depression and bipolar disorder to get people well and prevent suicides. We really believe that if somebody is living with a mood disorder, depression, bipolar disorder, or any of their forms, it's the loved ones around them, those parents, those grandparents, the siblings, the cousins. They're the ones who really care about that person in their wellness, and they're in a really strong position to support them. Yet sometimes they don't have the resources they need or the information they need in order to do that. So that's where we come in as an organization. We offer programs, educational content like this webinar that we are presenting right now, and other resources that really can help family members know what to do when their loved one is living with a mood disorder. We encourage you to visit our website, which is the hub of all of our resources, familyaware.org. There you can find web tools such as a depression and bipolar test, our caregiver stress test. We have a postnatal depression screening for moms. We also have some wonderful stories. We really believe in storytelling as a means of decreasing stigma and increasing help seeking. And so if you are interested in hearing real stories from families, you can see videos and written stories on our website. We offer an archive of excellent webinars on topics related to youth mental health, adult mental health, caregiving, communication. We have a treasure trove of resources on our website. And we also offer toolkits and action plans, just things that are free resources for families that are trying to help and support a loved one who's living with a mood disorder. So we encourage you to go there, look at our publications, look at all of our free resources. So before we go on, we're going to launch a poll. We want to get a sense of what people know coming into this webinar. So our poll asks, how confident are you in overcoming barriers to mental health care? Are you very confident, somewhat confident, or not confident at all? So we have these results coming in. A lot of you are somewhat confident. We just want to get a good sense of where you are. Give you all another couple of seconds as we have only about 70% participation. Give folks a chance to answer this question. Okay, so I think we have a good number of people who have answered. So let's end this poll and look at the results. So, 6% of you are very confident. That's great. Hopefully, you all are people who are coming on to listen to this webinar to see if you can recommend it to other people. You're coming in with a lot of knowledge. So, please do listen to what we have to present because you could learn more. And you might just say, oh, well, I knew a lot of this, but I know somebody who really needs this content. So, we welcome you. We have most people fitting in between that confident and somewhat confident. 50% of you all are somewhat confident. So that's understandable. And then 22% of you are not confident at all. We welcome you. We're so glad that you've decided to listen to this presentation so that we can hopefully by the end of it make you feel a little bit more confident about your knowledge of the mental health care system and how to overcome barriers. With that being said, it is my great pleasure to introduce our featured presenters for today. We have Dr. Margaret Geyer and Dr. Charmaine Jackman. Dr. Margaret Geyer is a clinician, researcher, and administrator who has worked with people with severe mental illness and their families for more than 30 years. Dr. Geyer's work is characterized by a persistent commitment to understand and address systemic barriers to accessible, effective, compassionate behavioral health services across systems of care. She has served as principal investigator on several SAMHSA service grants to address suicide, intimate partner violence, and early psychosis. Dr. Geyer works closely with individuals with lived experience, families, community advocates, and behavioral health providers to identify, adapt, and implement current best practices. Welcome, Dr. Geyer. We also have Dr. Charmaine Jackman. Dr. Jackman is an award-winning psychologist, author, TEDx speaker, and leadership coach. She is a leading voice on mental health and workplace well-being and CEO and founder of InnoPsych, a premier resource for impactful and inclusive mental health solutions. Dr. Charmaine Jackman leverages her experiences with burnout and racial stress to elevate conversations about healthy soul care practices and to inspire others to take daily actions and prioritize their mental health through joy and mindfulness. Dr. Jackman is the creator of the My Time to Thrive card deck, an interactive tool that reduces stress and fosters healthy coping patterns. She's also been featured on some major media outlets such as the New York Times, NPR, PBS, Oprah Daily, Essence, and the Boston Globe. Welcome, Dr. Jackman.
Thank you. Good evening, everyone. So I am thrilled to be here. We are in the wake of World Mental Health Day, so this conversation seems right on time. And I just want to start out as we talk about caregiver self-care, we have this conversation. We really wanted to elevate the importance of first taking care of you. And we know that as caregivers, there are lots of things to do. There are often things that go unnoticed, lots of decisions that you have to make as you care for your loved one. And the best way that you can care for your loved one is to make sure that you're caring for yourself. So we're going to invite you to share in the chat one thing that you do that brings you joy. Is it they're sharing in the chat or is it a poll?
The chat has now been enabled, so it should be.
Excellent, excellent. So in the chat, share one thing that brings you joy. I think leading from joy is really powerful. And then share how often do you get to practice your self-care? I think sometimes, again, we can often put ourselves last on that to-do list. So an invitation as we start out today is to just start with what brings you joy. And I see some things in the chat, walking in nature, music, yoga and cooking, pets, Lego, dogs, love it, love it. Thank you so much for sharing. And I think we're turning it back over to you.
Yes, thank you so much, Dr. Jackman. So, our conversation today, we're going to have a more conversational style webinar, hearing from these wonderful experts. And a term we will use, and a kind of a framework we will use for this discussion, is around the social determinants of health. That might sound like a really scary phrase for some folks who maybe have never heard it. So I'm going to read a very technical definition of social determinants of health. And then we're going to break it down so that people can understand exactly what that is and how it applies to mental health, accessing mental health care, and barriers that families might encounter. Mental health is more than just the medical part of it. It's not just informed by the doctors you see, the medication you take, or involvement in the medical system. The social determinants of health are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. So again, these are the non-medical factors influencing how we are, how we live, and how we feel in our health. These forces and systems include economic policies and systems, development agendas, social norms, social policies, and political systems. So again, that sounded very technical. We see this image here with these different sectors of what social determinants of health are. Dr. Geyer, can you walk us through social determinants of health? We can either stay on this slide or move through each one. How do you want to go first? You want to just talk through this slide or go to the next part?
Um, why don't I actually had a couple comments on this slide and then we can go on to the next one. Because I just wanted to, sort of elaborate a little bit that what we're talking about are the, as Valerie said, the conditions that people live in very much affect their health and their mental health. And at the same time, the conditions that people live in also affect their ability to access resources and service and treatment in order to try and address their mental health challenges. You'll see as we walk through. And I think this webinar is in the world of insurers, including our sort of federal and state Medicaid and Medicare insurance. There's a recognition that if people don't have food and homes and are not safe in their communities, that those are the largest determinants of someone's health and well-being. And if we don't address those, then we actually aren't addressing their medical and mental health treatment needs. And so it's often quite overwhelming to think about sort of trying to support a family member who's got a lot going on and there are a lot of things that they're not able to do. And I think the good news is that we're starting to recognize that we actually need to help people pay their rent and help people have access to food so that they have, as on the insurers, that is a medical intervention to try to address some of these matters. So I think that's an important context as we're sort of talking about things tonight. So if we can go on to the next slide. And I just want to invite Valerie and Charmaine also to chime in as we're talking. I think in some ways, economic stability is the sort of most obvious, but part of what we think about is so many different ways that economic instability really contributes to mental health problems. And just starting with just the discrimination and kind of the stigma that comes with poverty already sort of sets people up at a disadvantage. And then we think about things, having safe housing, stable housing, knowing that you can pay your bills, that means you have a good place to sleep. So when you look at most behavioral health disorders, sleep is the one symptom that crosses almost every disorder. So if people don't have a safe place where they can sleep comfortably and stably, they're already at risk or vulnerable and not able to do as well in terms of recovering. It helps to have a refrigerator, to have food, to be able to prepare healthy meals instead of relying on ready-made or, inadequate meals. You need a place where you can keep your medication. That's one of the, we sort of talk about medication is a really important part of recovery. But if you don't have a place where you can keep your medicine, some medicine needs to be in refrigerator. Again, it really jeopardizes and interferes with your ability to really be in charge of your own recovery. I saw pets. I'm a dog and cat person, so pets, we think about that as sort of a source of joy. Well, it's really hard having a pet if you don't have a stable home. It's really hard having a pet if you don't have the finances to take care of them. So I think, we know economic stability is clearly really important. And one of the things we'll talk about at the end, I think also, are just sort of what you can do and what the resources and how you can find ways to support your family member when they're not able to work and their sort of economic stability is really compromised.
Yeah, thank you.
Yeah, I was going to say, do you have anything to add to that?
Yeah, and I would even say, going back to the prior slide, I think one thing I like to name, just because the work that we do really centers the experiences of people of color, and they also have a disproportionate challenges with accessing these types of service. So the social determinants of health also cuts across, we talk about economic lines, but also racial lines. And so we see poor outcomes for people who identify as a person of color. So I just wanted to kind of name that in the background as well. But going back to the economic piece, I think you laid out such important points, Dr. Margaret. And I think that, affording medications, thinking about if you are impacted by the justice system, what might that look like for you as well, getting access? One of the things that's really exciting, and I think part of our conversation is naming some of the barriers, but also naming some of the bright spots. There's a recent initiative here in Massachusetts that's started a program called Art Pharmacy. And basically it is given access to arts institutions. So providers like myself can write a prescription for a client or patient to access some type of art event in the community. And I think we've talked a lot about accessing art museums, that's an economic barrier. And so this idea of art pharmacy is providing that access. So as we think about the conditions under which people live and thrive, having access to things like this also makes that living situation much better, and can give people bright spots in their day.
Excellent points from both of you. Dr. Geyer, what would you say about education access and quality with regards to how that impacts your health?
So this is, again, we think a lot about I think we're largely talking about adults today, but certainly in terms of children, it's very important. But for adults, we know that people with low literacy have a harder time accessing healthcare, collaborating with their providers, sort of understanding, prescriptions are usually in written form. You get lots of sort of handouts and worksheets. And so there's so much about the treatment that involves literacy that people with low literacy are really at a disadvantage. And then I think the other piece around education is that education empowers us to feel like we can be advocates for ourselves. And so people with who have not been able to graduate from high school or who are struggling with other stages of education, may feel at a disadvantage and so may not advocate or sort of pursue all of the resources and supports that are available to them.
Yeah, and I would add, and one of the things that is a barrier to mental health education and information is that there's this stigma that exists. And I know we'll talk about that even more. But one of the things that I was really proud of when I worked in schools is that we provided education about what is depression, what does anxiety look like, how do you recognize it in yourself or a family member or friends. And I think that education is power. I always tell education is power, and how powerful it is when young people and children understand what their symptoms are, because then you can communicate what you need, you can identify what you need. So I did want to talk about that education piece, because I think that there are a lot of places where that education isn't happening. And connecting back to our previous slide about economics, there's also very little financial literacy that's being taught in schools. So you start to see these things just pile on, right? When you don't have access to financial information, you don't have access to understanding your health and your mental health, it can make it really challenging to be able to identify what you need and then to feel empowered to ask for what you need, or to kind of look in the resources. And we'll talk about this, but it can be really hard and challenging if you don't know the mental health landscape. It can feel like a very different language, or like you're in a foreign country, right? So, we also have to do our part in making this mental health system more accessible for folks.
Yeah, I was thinking also when you were talking, Dr. Geyer, about if you get a medication, that packet of information that you get from the pharmacist. And then they have that little corner where you can go. And I think it asks you now on those little keypads, do you want to ask? If you're somebody who is having trouble reading it and you have to stand in front of everybody else there and have your medication explained and have it said out loud, and although most pharmacists are very good about trying to be discreet, you know, how are you going to feel going up and asking for explanations? And I mean, it's definitely another barrier. And I'm glad we're going to get to solutions as we keep going. But one that might be obvious to folks, the connection, but it's certainly important to go over is healthcare access and quality. How does that impact somebody's health? Having access to healthcare, and not only access to healthcare, but access to quality care, quality, timely, um, culturally competent or culturally responsive care.
Yes, so we will talk about sort of alternatives to traditional health care as well, and ways to get other support. We're going to do a couple case scenarios at the end. We know certainly in the United States that the availability of behavioral health providers is inconsistent from community to community, that people wait a very long time to get access, and that when you get access, you may or may not be meeting with a provider that speaks your language, that understands your culture or your community. And after waiting a very long time, it's hard to feel like you have a choice and that you can sort of thank you, but no thank you, and work with someone else. And in the absence of the scarcity, people are always recommended that you should interview a few different people and see who you feel comfortable with. And that's not realistic or possible for most people these days, whether you have health insurance or not. There's all kinds of challenges, and I'm sure that all of you who are listening sort of know these, the co-pays, the deductibles, the bureaucracy of do you take my insurance or not? All of those are really discouraging. And then when you're a person that is struggling with depression or other mental health challenges, some days it's really hard to get up and go and get to your appointments. And healthcare providers today have a
Mhm.
very short tolerance for people that are not able to reliably show up. And so we find that the people that need it most are the ones that are most often sort of discharged summarily because they've not been able to consistently make their appointments. And we're talking about each of these social determinants sort of in isolation, but if you don't have the money and there isn't public transportation, you can't easily get to your appointment. And so that even if you're not depressed and your depression, you're still getting out the door and trying to get there, there are all these other barriers to making it. Um, there's sort of some data points too that we have that I think are really important to just mention, which is that um, if you don't have a primary care, you're less likely to get the preventative screening. Even
Mhm.
people, you know, who have primary care, people with more serious mental illness encounter a lot of discrimination and sort of biases. And so they often don't get their medical complaints are not heard and addressed. So they are more likely to um, have serious illnesses detected later in the course of an illness. And then also, because of having a mental illness, again, they may not get the most aggressive treatment. Um, it requires showing up reliably, it requires sort of participating in a way that people think someone who's experiencing depression may not be able to. And so there's a systematic inequity in terms of people's access to critical medical care as well as the mental health care. So those are some of the things. That is really a
Yeah. No, I really agree with you. And this is one of the reasons that we actually started InnoSight, because we wanted to make that process of finding a therapist much easier than it currently is. It's like, can be like finding a needle in a haystack, but also the process can be really arduous, really challenging. And part of the reason I started InnoSight was because I was trying to find a therapist and I had the most challenging time. And I'm like, I'm a therapist, and if I'm having this much trouble, imagine what the average person is going through. So, I think those points are really important that you highlighted in terms of, if you have health insurance, and while there's supposed to be parity, meaning equity between health and mental health, in practice, that's not the case. And so sometimes you may have health insurance, but your mental health benefits may not be up to par. So that's also a challenge. You talk about the cost of paying for mental health services can add another burden. Um, I think you talked about the transportation piece, and you think about if you live in Boston, rely on the T, T has had some major challenges. So just imagine that. And, we are on a system where we see, clients, on the hour. And so if someone comes late, then like that can impact it, right? But how do we think about a medical system that recognizes these different challenges that people have in accessing their services? I wanted to add one other thing. Yeah, and I think too, like one of the things that I am extremely passionate about is also having mental health providers that are trained to work cross-culturally. And so unfortunately, that's not a given. Even here in Massachusetts, people are required to have a course. It's part to get licensed, but there's no requirement ongoing to make sure that you are keeping up and making sure that you are providing care that's culturally affirming. So that's something that I'm very passionate about. And so, having conversations like this, but also working with providers to make sure that they're also delivering services that's really affirming to you, recognizing your language needs and your cultural needs, because that can impact the quality of care that you get.
So, continuing this discussion, how does your social and community context impact your health? And in this case, your mental health?
Yeah, so I can take this one too. I think one of the things that we see across all mental health conditions is the need to have, I would say the worry is when people are isolated. In many mental health conditions, people tend to pull away from community. And so the idea of having a community support, having a group like this, an organization like this, where you can come and get education, being part of a group, being part of a community that has resources is really important to people living their full lives and thriving, regardless of the type of mental health condition that they have. I think we talk a lot about, I mentioned here that part of the challenges with the social determinants of health is that there's definitely a racial component. There are these barriers that were created, these systemic barriers that you as caregivers and your family members may experience when trying to access services. And so the idea of having community is really important. Having community that's free of discrimination and racism is really important. As I mentioned just now, if you're going to a therapist and they have no idea about your cultural background, your family values, or your cultural values, they may recommend something that's really inappropriate. And unfortunately, I've had people share those experiences with me. It can taint your taste of, can taint your thoughts about therapy in the mental health field. And that can sometimes be people may exit. They're like, okay, you know what? I'm not done with this therapy thing, right? And so the challenge is when we don't provide care that's culturally affirming, we actually make people, people can be at risk for further deterioration of their mental health condition because they're not going to access services. I really like, there was NAMI put out, it was a few years old now, but they put out some multicultural facts, and they showed the rates at which people of color, they looked at gender and different racial backgrounds. And I would say for probably about 85 to 95% of people of color at the time, I think the data was around 2015, but 85 to 95% of people of color who had a mental health condition did not seek treatment, did not seek therapy. And those are staggering numbers. That means there are many people out there in pain, accessing services. And again, there are a number of factors, and some of this is related to the social determinants of health, connected to stigma, and all the access barriers that we have named so far.
And to expound upon one thing you said also about your community context, if in your community there are only negative conversations about mental health, negative conversations about therapy, if you sit in church every Sunday and all you hear is, people who suffer depression don't have enough faith, they're not believers enough, that community context can influence not only if you get care, but it can influence how you feel about yourself. And on the opposite end of that spectrum, if you have a community where mental health is talked about as a necessity, as a medical need, as a positive thing to take care of yourself mentally, it can influence you in the opposite direction. It can make you feel like this is something that is important, and that whatever belief system I have wants me or supports me in being well, mentally as well as physically, then that can have a positive effect. Dr. Geyer, do you want to say anything before I move on? Because I'm also looking at our time. I'm sorry, I took up a little bit of time with my comments, but do you have anything to add, or should we move right on?
I'm sort of, I think I would like to add that, sort of part of what we all know is that the behavioral health system has not always been a hospitable, friendly place for people. We do know that people of color are more likely to get more severe diagnoses, presenting with the same sort of symptom picture. They're more likely to get sort of higher levels of care, more likely to have involuntary commitments to treatment, to have police involvement. And so there are real barriers that we as a healthcare system have to acknowledge, accept responsibility for, and really work to try to change. I was thinking one of the things we haven't used the word trauma informed tonight, but I think that we're really talking about transforming our healthcare system so that it is trauma informed and understands the impact of racism and discrimination, of involuntary treatment, of having, living in a community that is not safe or not being integrated with your community. And so I think that's an important part of what we're also talking about here.
I agree. It is. It definitely is. I want to just acknowledge that we got an excellent question sent to us in the chat. We're going to hold on to it to the end. It's about providers and how they are even credentialed and the differences between providers. I do see that question, and we'll make sure that these wonderful experts address it at question and answer. But for the sake of time, we're going to move on to our final quadrant here, or our final section of those social determinants of health: neighborhood and environment.
So I think here we're talking, it's sort of, if you don't have financial resources and you are living in a community that you don't necessarily choose to live in, where there's a lot of violence, that has a huge impact. If you're living in a community where there's you're more subject to pollution, just sort of the impact of climate change, that takes a toll on your physical and your emotional health. Living in neighborhoods where you have access to transportation, and we were, people were talking about taking walks and being out in nature as a source of grounding and joy. And so if you don't have access to fresh air and green trees. And then I think we included here, and I don't know if we've talked about food deserts, but sort of, parts of cities where there are no grocery stores and people cannot easily get access to healthy food. That really impacts people's well-being and emotional health.
I think I would add neighborhoods that are heavily policed or over-policed can also impact your mental health. It creates that sense of unsafety, and particularly for people with mental health conditions can be targeted. So I think that's another piece that I would want to add in here as well. And I think in terms of the workplace, I love that we, we think about environment in the places we work. There are enormous amounts of stress that people are dealing with in the workplace in today. Numbers, burnout rank in the 70s and above, stress levels, anxiety levels. And so our workplaces are also a significant contributor to our stress. And so being able to access and have a workplace that's free of stress or reduce stress is really a necessity for us as we navigate our mental health. Being able to know how to ask for accommodations, and feeling safe to ask for those accommodations if you do have a mental health condition. How do you ask for leave if you need to take leave? So those are things that can make that mental health journey more challenging as well.
Absolutely. So we've now talked about these different aspects, these social determinants of health. And just to recap for people who are following along: education, access, and quality; economic stability; social and community context; neighborhood and environment; healthcare access and quality. When we look at these, Dr. Jackman, we're going to stay with you. Why should caregivers be concerned about these, and how they impact their loved one's mental health? Can you put that in context for us a bit?
Absolutely. And I think we've named some of it as we've gone along today, but I think that what can often happen as a caregiver, you're trying to make sure that your family member, your loved one, has what they need to be well. And imagine at every turn, there's a barrier for economics, education, your neighborhood, right? It can just add to the load. It can really feel like it's piled on. And I think part of the challenge, I would say, for caregivers is that we often feel that all of these things, that there's something you're not doing, that you're something you're not doing enough of. And that could lead to feeling helpless. It can feel guilty. You can feel disempowered. And what we want to lift up in this conversation is that when you're feeling that stress, when you're feeling weighed down by being able to access support or have a provider call you back, or whatever those challenges are, we want to locate it in the system, in these social determinants of health, and not in something that you're not doing. So I think that's one of the important things we want to recognize, that all these things can just add to the fatigue and to the stress and to just trying to provide the care for your loved one. And imagine if you're living in a different state than your loved one lives in, right? You're caregiving from a distance. That can just compound that feeling of feeling inadequate or not being able to provide for your loved one.
That is such a great point. And I think we as an organization, Families for Depression Awareness, we hear from caregivers, why is this so hard? It's why we titled this, Why is this so hard? When you look at it this way and you see everything you're up against, all of those challenges, you can say to yourself, it's not just me, we're not just failing at this. It's just really hard. If you have
Mhm,
multiple, if you're being affected by multiple parts of these social determinants of health, you have so many things that you're pushing against, and
mhm,
they can all individually, maybe individually you could solve the transportation issue, or you can find money to pay for this care, or you can find, but when you're dealing with many of these, as you said before, and they're overlapping, it can feel impossible. So we hope that those of you who are listening, who are dealing with these challenges in your family, you can take some solace in knowing that these are some of the reasons why it might feel so hard. We also want to make sure that people can understand how this might look in real life. So we've come up with two scenarios. I'm going to read these scenarios, and then we're going to have Dr. Jackman and Dr. Geyer respond to these scenarios so that we can hear what this might look like in real life and then how you can overcome them. So we're going to start with this first scenario, finding care and overcoming fear. So Dr. Jackman, this is to you. Here's a scenario. Your loved one is interested in trying talk therapy, but there isn't a nearby provider who takes their state-funded insurance. So let's say they're on Medicaid and they have some state-funded insurance. They want to try talk therapy, but this is the insurance they're dealing with. They also don't speak English, and they need to be able to access whatever this care is through public transportation. They don't feel like they can ask anybody for advice because people will label them as crazy or weak. So that's stigma, of course,
mhm,
and
mhm,
incorrect and just not true. Um, how
mhm,
can the caregiver in this situation provide support? So again, for those of you listening, somebody is interested in talk therapy, but they need somebody who takes their state-funded insurance. They need to be able to access this care through public transportation, and they need somebody who speaks their language. What would you
mhm.
say to the caregiver in this situation?
Right. And yeah, these are enormous barriers. So I'd say, so the insurance thing what we talked about, right? So most private, most therapists who are operating independently or private practice, they really take state insurance. And part of that, just to give you context, is that the reimbursement rate, what providers get paid, is extremely low. And there's often a burden of paperwork. So the paperwork burden goes like both ways, right? For the provider and for the patient. So for many therapists, they're just like, I don't want the hassle. So that just means that then your only access is to access a community health center that has mental health services. And then that means you're likely on a long waiting list to get that treatment. So I'm just naming the barriers. We're going to talk about, how do you navigate that? Even if your family member speaks English, right? So we're saying they don't speak English, but even if they spoke English, but English is a second language, they may feel more comfortable talking or having a session in their primary language, right? So that becomes another barrier, right? We often talk about our emotions are in our primary language, right? They are located in that primary language. And then the accessibility piece. So I think when we talk about where we were looking at that social determinants of health chart, We see healthcare access, we see economic stability, and the discrimination and stigma that comes from how do you ask for help? And so this is, yeah, thank you for shifting to this framework. So this is a graphic that I created just to kind of really name some of the things that get in the way. You might hear, Valerie, you talked about, sometimes our faith communities isn't understanding of mental health, right? And it's really a lack of knowledge and lack of understanding. So family members might say, just pray about it, or your faith leader might say, just pray more, right? You can't express yourself in English. And again, that process of finding a therapist can be really challenging. You might have grown up with messages that said, honestly, like our healthcare system has been dishonest with certain communities, has violated that trust. Men often are socialized not to talk about their feelings, right? And it can go on and on and on. So all these things become ways and barriers to accessing that care. And so how do you get into ways where you are navigating those situations? I think part of it is really remembering you're not alone. And I think that's the first thing we want to say, you're not alone. And so having an organization like Families for Depression Awareness, like InnoSight, we're here to help. So making sure you're coming to workshops like this, right? So people are going to share resources. I think the other piece is about sharing the successes that you've had. If you've, found and I've seen this where someone has like a direct number to somebody in the insurance, right? It's like, pass that on, right? So someone else doesn't have to go through that challenge. And remembering that, as you help your loved ones, as you're looking for this support, that you also have to kind of manage your energy, right? Sometimes you're going to face family members who are adding to the stress, right? Because they are going to push messages that really counter your focus on getting support. They're still, at stage one where they're trying to understand what mental health is. And so for you, it's really managing your energy. How are you kind of navigating those conversations? Setting barriers with them, right? To just say, you may not agree or you may not understand. Here's how I need you to help. What you're saying is not helpful. So being clear and feeling empowered to have those conversations with your family members, because you don't want to cut them off if there are ways that they can help. So you may want to be very directive about the ways that you want them to help you. And I think it's been really powerful when we see stories like Naomi Osaka and Simone Biles share their stories of navigating their mental health journeys. It kind of allows us to see that we're not alone in this journey. Okay. Understanding the mental health, I call it the alphabet soup. Sometimes the way in which we talk about mental health, or the different things, we often use acronyms. And if you're in a room with your loved one and with a provider and they're talking things and they're above your head, ask them to slow down and ask them to repeat that. And that's okay. And they should hopefully respect that and stop and slow down, right? But sometimes you have to pause people and don't be afraid to say, what does that mean? Even sometimes we know all the words individually, but when we put them together, they make no sense, right? So pause and ask them to clarify for you. Take notes. I would say take notes. When you go into those meetings, have a notebook and write down, because sometimes there's so much information that you're being given, it can be hard to remember that at a later time. So I think I mentioned this earlier in terms of options within the system. So those community health centers are a source. The challenge sometimes is that they're waiting list. Some providers may offer a sliding scale, so they have a fee that's based on your income. So that could be a way to access those services. I think some of the bright spots where, coming out of the pandemic is more providers use telehealth. So that can definitely address some of the barriers, the transportation barriers. You do need to have a pretty strong Wi-Fi system. So those are things that you would want to make sure that you have access to. That can, again, create another barrier also. There are some clinical trials where you can get access to treatment, particularly some medications, and they're usually experimental. And I think people, particularly in the Black community, can be very wary of those. And so I think there, just so you know, there are lots of protocols that are in place to make sure that the consumer is not harmed. So, 50 years ago, that might have been a different story, but those clinical trials of today are very different. And so, again, in any situation, always ask questions. No one should ever force you to do anything that you don't feel comfortable doing. And your provider should be in relationship with you, having conversations with you. And if you have hesitancy, that they are walking the line with you and not pushing you to make a decision in one conversation. All right, so what do we have here? Alternative care considerations. Yes. So, I talk about this a lot, right? As a therapist, we often recommend therapy. And when we say therapy, it's usually the one-on-one individual therapy. But there are lots of other things that I think people can access that can create an environment that helps you live a full, thriving life. So support groups, peer support groups are great because you're in a room, in community with people with similar lived experiences. They will have navigated some of the systems that you're trying to. They may have some shortcuts to help you bypass. They may have resources that you may not be aware of. So those support groups, whether it's for your loved one or for yourself as a caregiver, are really key to making sure that you stay on top of what's current and that you have access to different supports as well. Engaging in mental health advocacy, I think advocacy and activism are really powerful ways to feel empowered again. And as I mentioned, asking questions, I feel that's a way to advocate for your needs. So you might be advocating at little small levels, but also big levels, working with your city leaders, your mayor, your state leaders to push for policies that support your well-being. Digital tools, I think those are really great. I consult on some mental health apps. Those are great for monitoring and tracking your mental health on a day-to-day. I think they could be great resources that you can see between sessions with your therapist. And then most particularly larger organizations will have an EAP or employee assistance program that will provide resources. InnoPsych does a lot of work with that, providing workplace well-being workshops that help leaders and managers really create programming that increases awareness about mental health. And so having access to those resources are really important. And I think if you are working in a larger organization, make sure to check in with your HR and see what's out there because there are often lots of resources that people underutilize in the workplace. And some of those can be free as well. So make sure that you check in and understand what resources are available to you. I can't emphasize this one enough. And that community is really important. You know, you are not alone in this. And finding that community, walking hand in hand with someone else can help you feel stronger and more empowered as you face these systemic barriers. So I know that was a lot. So definitely pop your questions in the chat. What I wanted to do is just kind of model a pause to give us a minute before we turn it over to Dr. Greyer. So one of the things I love to do is just simple 3 deep breaths. And I'm just going to walk you through it. You can do it if you want to. I can't see you. So if you don't, that's okay too. And so the idea is you can take a breath through your nose, breathing in And slowly exhaling through your mouth. Another breath in. Exhale through your mouth. And take one more breath in. And exhale. And then just do a quick body scan. Where do you notice any tension or tightness in your body? And just ask yourself in this moment, what do I need? And that's a great way. I think that probably took less than a minute, but this is a great way during your daytime when you're facing a barrier or a challenge. Take a moment, take a breath. It can help you kind of rethink and come at the problem with new and fresh eyes.
Thank you so much, Dr. Jackman. We're going to go to our second scenario, but before we do, how do you feel after doing that breathing exercise? Are you feeling a little bit calmer? You're still pretty anxious because we're going over a lot of information. Are you energized? Just give us a quick sense of how you're feeling right now. And then we're going to go to our second scenario. Okay. Got about 50% of people participating. Let's get the rest of you. Tell us how you're feeling. Another 5 seconds or so. Okay, so most of you are feeling calm. That's good. Deep breaths
Yay!
don't cost any money. You can do deep breathing wherever you are without any special equipment, and it can really help center you, ground you, and get you back, especially when you're hearing a lot of information or if you've just had a busy day and you're feeling overwhelmed. Some deep breaths can definitely help. So glad that you all are calm, that some people are hopeful, confident, and optimistic. That's awesome. So let's go to our second scenario. After this scenario, we will be moving on to question and answer. So continue to put your questions in and we will get to them at the end. This is scenario 2 when depression hits. And Dr. Guy, we're going to go to you for working through this scenario. It seems like your loved one's world is shrinking. Since their roommate moved out, their depression has been getting worse. They're barely leaving their apartment. They're in danger of losing their job. They've quit their choir that they loved to sing in. They can't afford the rent by themselves, so they're resigned to move to a cheaper place that is more affordable, though where they can move to is less safe. It's cheaper, but it's less safe. They won't answer you when you ask if they're taking their medication or going to their therapist. So basically, they are just shut down. They're withdrawing. They could lose their job. They may have to move because they can't afford where they're living. Again, this piling on of all of these different issues. What strategies could a caregiver use in this scenario?
Thank you, Valerie. I was thinking we all need a deep breath again, so we may need to do some breathing because, I'm thinking about just how disheartening it is when someone we care about is suffering so much and really just does not have the energy, and is I think a real challenge often is that people are not as receptive to sort of caring family kind of coming in and taking charge. So I think that sort of taking a deep breath and thinking about ways to let the person know that you care and that you are available and that you want to sort of, before you start coming up with solutions of things they should be doing or could be doing, to really take some time to listen. And I think we, as family members, underestimate just the power of our persistent kind of love and compassion, even when there is very little that we can concretely do. Having that sort of validation and positive regard and love is really just, that's what people remember the most. That my family didn't give up on me. They didn't stop loving me. they didn't stop caring about me. But some things to just, I was thinking when Dr. Jackman was talking, one thing I don't know that we've mentioned tonight is that there is, everyone should know that you can call 988 24/7. And that is a place where it's primarily for people that are themselves in distress. But if you are concerned about someone, you can also call. And it is, each state does it slightly differently, but all of the 988 centers have resources guides for their local communities. And so that is a slam dunk quick way to find out where are those community health centers, where is their care place where I can go, how do I get rapid support and resources, or 988 is a place where you can call and talk to someone. So I just think that's a really important resource. And then sort of similar to that, the other resource that most states have is also a 211 program. So 211 is sort of like 411 used to be. I can't even remember because we don't use 411 anymore. We just Google it on our phones. But 211 in most states is staffed by people that have kind of at their fingertips. How do you find a farmer's market? How do you find fuel assistance? How do you find help for hearing aids? How do you find a 24-hour pharmacy? They are charged with gathering as much information as possible so that they can answer, questions. Where do I find childcare? How do I find a voucher for childcare? All of those kinds of questions. And so 211 is also sort of like if you take nothing away from tonight in terms of sort of where to turn to, I would say 988 and 211 are sort of the two kind of things to remember. It's also what you can do with the person's, I think someone put in the chat the question, or sort of a very pointed question pointing to the answer, which is when you think about talking with your family member, you want to do it in a way that's collaborative. And so if getting a job is their goal, then if you can do some of the homework of figuring out the job training center, go with them, because often the hardest thing is just taking that first step. So if you can accompany them, that is something that you can do. Mostly sort of providing information and then offering to accompany or identify someone that could accompany them. There's a national program that's called SOAR that you can call, and they will help you with your application for benefits. So those are the kinds of resources where I've looked at those benefit packets and they're completely overwhelming. And so it helps to know, I think in the fall, often as part of the Medicare re-upping, there are people in your local library is a fabulous resource. Walk into your local library. They are more and more every single day wanting to be the place where community members turn for information. And then I think this is a really important point, and I think Dr. Jackman spoke about, educating children and youth about signs of mental illness and mental health and how to get help. It helps all of us to have that information as well. So the more that you sort of understand what is happening for your family member and what the treatment options are, then the more you can sort of help them think through what they might be willing to try and also advocate for them.
Yeah, I love that, Margaret. I think too, having those conversations when people are not in crisis is really important. Document when you are feeling this way, how do you want me to support you? How do you want me to get involved? I think that's a really great way to have those empowering conversations with your family member. So when when they are in crisis, you can say, well, here's what we talked about. And then you are acting in collaboration and in community with them, so people don't feel like something is being done to them, right? They still maintain a sense of control.
A really good point.
Anything else you want to say on this slide before we move on to other strategies?
I think we can keep going. Yeah. I think this is that a lot of these are a combination of sort of things that you can do, that you can research to make available and sort of help your family member. And I think on one of our earlier slides, or maybe it's coming up, I can't remember, but one of the pieces of advice was the more comfortable you are talking about your own mental health struggles or struggles that others in your family have had, if you can find that level of comfort, and maybe it's just with one person, maybe it's with a best friend or with a sibling or a minister or a teacher, but the more you are able to be comfortable, then the more you're going to be able to sort of model for your family member that it is okay to talk about these things and to share and get support from other people. So I think the idea of connecting with others informally and formally is a real big part of taking care of ourselves as caregivers, but also really trying to help encourage our family members to connect with other people so they feel less alone. They feel less like there's something terribly wrong with me. And they are less socially isolated and can find ways to build those skills to have those social connections. And I think some of these are very sort of important, concrete suggestions of, applying for benefits and then using those benefits to go to local farmers markets, or I think it's with Medicare, but I think also Medicaid in most states has a transportation benefit. It may be a little complicated, but once you get it in place, then people can get to their medical appointments. And so just exploring those things. I also wanted to say, I think the communities online, certainly in Massachusetts, there's, families with family members with mental illness, and there is a huge community support as well as very practical and concrete ideas about how to solve particular problems or challenges. And I think that's something we're very fortunate at this sort of era, that's available to all of us. Okay, let's keep going. So these are some really nice, I think, ideas about, in some sense, part of there's sort of a common acknowledgement that when someone goes into the hospital for a broken leg or to get a medical treatment, everybody sends flowers and cards and they visit. When you go into the hospital for a mental health challenge, often you don't tell anybody. People don't send, I don't know if anyone's ever gotten flowers when they've been psychiatrically hospitalized. And so there's this real stigmatization and marginalization when people are experiencing mental health crises. And so I think there's something about really trying to build your circle for yourself of people. It's I think I'm giving you all these sort of like things that people say and experience, but sort of, when someone is dying, you find out who your friends are, right? Because when someone in your family is dying, lots of people that you thought were your best friends are gone because they're not so comfortable. And then you notice who the people are that really show up. So it's a little bit similar of sort of noticing who shows up for you when your family member is struggling, and cultivate those relationships. And those are the people that are going to be your community. And then you can talk with your family member about, let's bring some other people in because I can't do it all by myself. So, my friend Joan said she can drive you. I'm going to, and then you're helping them get over isolation, building a little bit more of a comfortable relationship, and knowing that this is not such a secret, that it's not just sort of within our family. We can bring more people in.
I can't express how wonderful all of that was in terms of getting strategies and explaining how each of those different categories that we discussed in the beginning, social determinants of health, can really impact mental health. Just want to remind everybody listening that um, it can be very overwhelming to support a loved one who is living with mental health condition and also is facing all these barriers. It can feel like, well, I can't solve all of these issues, or I can't help them navigate all of these issues, but that doesn't mean you can't do anything. So you may just want to tackle issue by issue, um, deal with the financial aspect of accessing care, or the financial maybe they're having trouble getting a job and staying employed, and that those economic factors are really impacting their mental health in so many different ways. You well then maybe it's let's just focus on updating your resume, and that's a way I can support you. You can start small and then also be connecting them with other folks in their community. So it doesn't all land on you. Those are things that you can do. And then, like I said before, when you're dealing with it issue by issue, it can sometimes feel more manageable. You really matter in that person's life. You want to take their lead. It's their life. They get to have a say in how their life is, whether they have a depression or bipolar disorder, it's still their life. They have a say. You're there to support them, and there are things you can do. So we just want to make sure that caregivers are hearing that message. We're about to get to question and answer. Stay with us. Use the chat, use the question and answer function for Dr. Geyer and Dr. Jackman. They're going to answer your questions in a moment. We want to thank you all for being here with us. Be sure you fill out the survey. We're going to put the link to the survey in a chat. And we also want to know, how confident are you now that you've heard this wonderful content? How confident are you that you can navigate some of these barriers? So let's throw up our last poll here around confidence. It should be popping up any minute now. Here we go. How confident are you in overcoming barriers to mental health care? So same question as the beginning. We just want to see if we've moved the needle at all. So looking forward to seeing these results. We're already seeing we've moved some people away from not at all confident. That's great. Give you all another 10 or 15 seconds. So we have about half of all participants weighing in. Let's get another few people. How confident are you? This is great. We definitely saw some movement. We know we can't solve all of this in one presentation, but we want to definitely be giving more strategies. Another 5 seconds or so. All right. So we have definitely moved everybody out of the not confident area. That's good. We've moved some of those somewhat confidence up, and we have still some people who are feeling really good about what they've learned. So that's awesome. We're so glad that we've made a difference in your level of knowledge around this topic. So I'd like to thank our funders, Takeda Lundbeck Alliance, AbbVie, Johnson & Johnson Innovative Medicine, Massachusetts Department of Public Health Suicide Prevention Program, our corporate members, Sage Therapeutics and Biogen, Takeda, Johnson & Johnson Innovative Medicine, Neurocrine Biosciences, and Alkermes for making sure that our programming can be free to the public, so that people just like you can take advantage of hearing from these amazing experts, who you probably have to be on a waiting list to get to talk to them otherwise, but we're bringing them to you thanks to funders and donors like you. So if this programming has been impactful for you and you'd like to donate, you can do so on the familyaware.org website. So we are going to start with a couple of the questions that were submitted ahead of time, and that'll give me a chance to go through the chat and pull out some of those questions that have come in as we've been talking. So some of these are practical questions that have to do with depression. One question asked, what if my loved one is so low and exhausted from depression that the thought of seeing a new provider is overwhelming?
Thank you for that question. And I think that it's important to acknowledge that. It's really important to acknowledge that that is a huge concern. And maybe one thing you can think about is, if you have identified the provider, is what are can we start with a virtual session versus going in person, right? Because that takes another level of activation. If they're in the process of looking, right, is that something you can narrow down? I always have people say, well, I'm looking for a Black therapist. Like, well, give me some more information. What are you looking for, male or female? So try to also help them narrow down what their ideal would be, knowing that that might not always be possible, but that could also be a way to start. But I think the first thing is to validate that concern that, yes, this does feel like a lot. You don't want to change. You don't want to start over again. But also recognize that therapists have a way of helping people through that initial part. So that's something that can definitely share with their new therapist, and even make a plan about where you start in that process. You may not want to go over your history again, and communicating that to your therapist, to the new therapist, as a way to say, where can we start? I think that's a great way to kind of help your family member, your friend, stay engaged in that process.
Okay, we have, thank you for that answer. We have another question that was addressed a bit in the chat, but I'd love to give you all a chance to tackle this. Why are providers with social worker licenses allowed to call themselves therapists? What are the different levels of service we can expect from an MD, an MH, I guess that's like mental health provider, social worker, nurse prescriber, nurse practitioner, etc. So just question about accessing therapy. And this is also extremely well on topic, because you may not have a psychiatrist available to you, but there might be a psychiatric nurse practitioner that you can see. So the first part of that question is, why do people with social work licenses allowed to call themselves therapists? And what can you expect from those different levels of service?
Absolutely. I'm happy to jump in, but Dr. Gary, you want to start?
And then we can continue. So I think it is accurate to say that anyone can call themselves a therapist, that there's no regulations around what constitutes a therapist. So you go to a physical therapist, you go to an occupational therapist, you can go to a yoga therapist. Where regulations tend to occur across most states is looking at what is the sort of level of credential that someone has. Do they have a bachelor's degree? And people with bachelor's degree are more likely to be able to help with sort of concrete tasks, like let me help you do your benefits application or get to appointments. Master's level clinicians and providers have more years of education and usually have practical direct care experience that's required as part of training and as part of getting licensed. And they are in every single state recognized as what are called independently licensed. So they are licensed to provide behavioral health services, psychotherapy, psychoeducation, support groups, therapy groups, family groups, et cetera. And so the master's level is most commonly what every state recognizes as a licensed, they wouldn't call them therapists, but social worker or psychologist or mental health clinician. People with doctorates have even more years of education and years of supervised experience, and are more likely to have experience and training in managing people with high risk. That doesn't mean that people with master's degrees aren't also great at that. Again, it's usually more about the person, and it comes down to, is this helpful to me? And so I think that's really important, to trust how you feel with the person. That's a better indicator than the letters after their name are. And then the MDs and the nurse practitioners, for the most part, they are primarily trained and used to provide medication and other sort of medical interventions. We haven't talked about, ECT and other kinds of other treatments, but they would oversee those kinds of treatments. Some of them have training in doing talk therapy, but it's less of what they spend their time doing these days.
Appreciate that explanation. If anyone is still has questions about that, put it in the chat, because there are several different kinds of professionals that can be involved in mental health care, and it can be confusing to know who can do what and who you can go to.
Can
We
I
have other,
jump in
yeah,
real quick?
yes, please.
And I would say you can definitely ask the provider to talk about their training if you have questions about that. Most importantly, I always tell people, and I pop their link of frequently asked questions, like ask them, do you have experience working with the issues that I'm working with? Or do you have experience working with Black women, right? If that's important to you, ask them that, and then they will let you know. And think you do want someone who's had some experience working with a particular issue that you're coming to see them for. But you absolutely have that right. And I know sometimes we talked at the earlier in the beginning that sometimes it feels like you don't have a choice when you maybe waited for 2 or 3 months to get this person, you feel like you have to just take. But I think engaging in those conversations would be really helpful. And if they can't do it, maybe they have someone in their network that they can refer you to that maybe might short circuit that wait time. But I think it's really important for you as you're starting out with a new therapist to have a conversation about your goals and their experience working with the particular issues that you're coming to them for.
I think that's helpful to point out. And another thing I would add to that, and forgive me if you all already mentioned this, but there are pre-licensed mental health providers that can still, they're under the supervision of a licensed clinician, and they can oftentimes provide care at a lower cost. That doesn't mean the care isn't still good or they're not qualified. It just means they haven't gotten their licensure yet. So that can be a wonderful option if you found the right kind of fit, the right kind of provider, but you need somebody who's affordable, and you can't pay one of those experts that maybe has 30 years of experience, but here's a very qualified professional who's under supervision. And sometimes that can be good too, because they are being overseen
Yeah.
by somebody who's more experienced and can get that feedback, and that can be a great option as well. So I just wanted to point that out.
I have one quick more addition. The other that we talked about state licensure. So every state has their own credentialing and licensing for social workers. And so your therapist, if you move to a different state, your therapist may or may not be able to see you because if they're not licensed in that state. So I'm licensed in Massachusetts and Rhode Island, so I can only see clients who live in those states. So that can become a barrier as well. So if you know you're going to be moving, definitely plan ahead and have those conversations with your therapist.
Yes, for sure. So this is a question I want to add in, and then I'll go back to the questions that are here. I think one of the things that caregivers struggle with when there are those overlapping barriers or overlapping issues is triaging, figuring out what is the most important, what do we need to work on first, and what can wait. So again, this is just a scenario I'm pulling. You have your adult sibling lives in rural America, and so it's hard to find a provider, but also she's struggling with her housing and her depression is very, very bad. So you have these issues. I'm in a rural area, it's hard to find providers. Maybe I can't afford to pay for it anyway when we find them, and I have issues with my own mental health right now. How do you figure out what to work on first? How do you figure out what's the most important? Is it getting their mental health stable, then worrying about the housing and the access to food and the access to it? Like how do you make those decisions, and what does that process look like, or can it look like?
Yeah, I mean, I think for me, the first thing is like safety, right? Are they safe? And that might be psychologically safe. Are they in crisis, right? You mentioned maybe they're having a really tough time. So I'd want to assess, are they at risk for harm, right? So we want to make sure if that there's a safety concern, I would definitely want to address that first. it can be really challenging to know what to tackle first and what resources are out there to tackle a particular issue. But for me, I would start with, let's make sure people are safe. I'm curious if Dr. Geyer has another perspective to add.
I agree with you completely. I think that's the first thing to be thinking about. And I would simply add, I think that's a good time to make sure that my sister knows 988 and knows how to call that number, and has a chance to. I think someone also mentioned before, it's always good to do these things when you're not in crisis, to sort of when my sister is feeling good, that's a time to call 988, see what it's like, who you get, and sort of pilot it or trial run it. I think it's also, if people have primary care providers, sometimes they can be very helpful in the interim while you're sorting out some of these other things. So I in some sense, it's sort of, you want to look for also what's the lowest hanging fruit. Where can you have some impact so that your sister will feel like, okay, there's a little hope. We've got a little momentum. And that may be even more important than sort of addressing one or the other of those issues.
I think that's a great strategy. What can you accomplish and you feel good about it, they feel good about it. You can have that small win and then move on to the more difficult task once you have established that they're safe and you've engaged their primary care provider who they already have and have a relationship with and maybe feel good about. I love that answer. Okay, I think we have time for one more question and then we'll start to wrap up. And this is a big one, so we'll end with this one. What is being done to assess how the mental health care system is working and how people navigate it? What bigger systemic changes are being tried either in Massachusetts or nationwide to make it easier to get care, access care, pay for care? Give us some hope here. What is being done by any governmental body or even on the advocacy front to make navigating mental health, accessing mental health, and getting people to where they want to be with their mental health to make that better?
I'm glad you asked that question, because you just reminded me of a really important resource as well. We talked about community health centers, but one of the things that the federal government has done is funded called certified community behavioral centers. And I will say, as a clinician working in this space for a very long time, when I first read about what they're called, the CCBHCs, Certified Community Behavioral Health, what they provide the soup to nuts mobile crisis. So mobile crisis is when you're not safe, when you're in such a state of despair that you can't manage on your own. Mobile crisis, every single state has mobile crisis and they will respond. I got completely distracted. So the CCBHCs often, then they offer ongoing treatment and services and peer support. And so we haven't talked a lot about substance use, but that's a very important factor for many people with depression, and then also a major behavioral health factor. So the CCBHCs are a really good place to go for help.
Any final thoughts? Yep.
Yeah, in the wake of the pandemic, we've seen a lot of attention focused on mental health. We see our state leaders and federal leaders really putting attention and money towards it. There's a huge focus on improving the mental health, the behavioral health workforce. So there's a lot of money going towards creating opportunities for people to get into the field, make it easier. We see the U.S. Surgeon General, he's put out about 5 reports that focus on mental health and stress in the last 4 or 5 years. So it's clearly on the mind of the White House and at that federal level. We've seen wonderful state initiatives as well. I think the art pharmacy that I talked about is a really innovative way of thinking about mental health beyond just the therapy, but thinking about the whole person and how do we put people back in community and give people access to joyful experiences in their community. So I think those are some highlights that have come out from the mental health. And then of course, telehealth has made a big difference in giving people access to mental health services.
So there is hope. You've both given us hope that there are things in the works to make access and care easier, and to also combine services so that you are maybe getting a lot more from one place, and maybe some of these pocketed or siloed kinds of services are being connected so that folks can get help in fewer places than ping-ponging around and trying to cobble together help and services. Thank you so much to Dr. Geyer and Dr. Jackman for their excellent advice and for the resources that they've offered. We appreciate you. We encourage everybody who's watched this presentation to complete our survey. The link is in the chat. It's also on the screen. And if you download the PDF of the slides, you'll find it as well. Let us know what you thought of this program, what other kinds of education that you need that will help us as an organization provide more programs like this in the future, and to be able to evaluate how effective we are. We do have a companion panel discussion coming up on October 24th, where you can learn more about peer support, warm lines, clubhouses, and disability benefits. This is in continuing our series about how to access care and how to look in different places to get that kind of care and support that you need. So that's another free event. Please check that out on our website, familyaware.org. Thank you so much for being with us, and we hope you have a wonderful day.